Welcome back, dead listeners. All right, today I was going to kind of just talk about the one time I was able to go through some training. I did not learn how to do it, but I watched somebody embalm a body. If you put aside your childishness and think of this as a learning experience, stick with me. If this is going to get weird for you, this is probably not the video for you. All right, so let's begin. Embalming is a process where they inject a fluid in through the body to help preserve it. In doing this, it's going to flush out all the blood, so blood out, and it's going to replace the vessels and tissue with this chemical substance that will essentially make the muscles work like putty or clay. You will be able to move the body and it will stay in that stiff position. And yes, it also includes like the tissue in the face. So if you pull a person's lip up, it kind of stays up. It's weird. And so here, let's begin. When I started this venture, the gentleman that was embalming had the body laying on an embalming table. There is a drain down at the bottom here. And then it's like a metal bed, right? A pan. And this part is tilted higher than this part so that everything drains downward. Yes, drains. Because what he'll do, he starts at an artery right here about. And it's the artery that, what do you call it? The main artery that goes into the leg from the heart. All right. And he will find that artery. And it was weird because when I touched it, the artery was like a hard wire. And he said the reason it's hard is because the blood has coagulated or dried up inside. And when he cut it open, it's not like the person started bleeding everywhere. The person's been dead and they had been in the cooler for about a day. So nothing came out. Then he took this kind of like a tube, and the tube was thinner at the tip and then bent like this, literally about this size, and then it got thicker, and then it was hooked up into a larger machine, and there was an opening right there. This tube here, he inserted into the large part of the artery facing downward in the leg. He also took a bunch of fluids, depending on this person's race. Mostly the fluids are pink. There are some that are a little yellow, some that are a little brown. Depends. If they were African American, he would tend to use the darker fluids. If they were a paler race of European or Asian, obviously the yellows and pinks would come into play. Once he had this item secured inside the vein, so it was kind of like like this. And here's the funny part. He actually took the tube that was running from the end of it that was, allowing the fluids to flow through, and he wedged it in between the person's big toe to hold it into place, because once you turn the machine on, it starts pumping the fluids in pulses. And pretty soon the leg started to turn a natural pink color instead of the pale, pasty, grayish color. The toes were very gray. You obviously see there was no circulation for a while. After about 10 minutes of that, he stopped the machine, tied off the vein here with literally what looked like dental floss, and then he turned this tube around the other direction and then started the machine again to pump the fluid into the rest of the body in that direction. Now, at one point, this person's body started to turn like the pinkish color, and the rigor mortis in his or her hands were making the hands curl. So he started, after the fluid started pumping in, he started to work the hands a little bit, and pretty soon her hands stayed open. Obviously, now I've given away the fact that it was a woman, but not like you guys know who it is. Anyways, at a certain point, we noticed that the other arm from about here down was still a very white, pasty gray color. And he said sometimes there's literally a blood clot in the vein that's not allowing embalming fluid into that part of the limb or other limbs, sometimes all four. So after the rest of the body looked embalmed enough, he shut off the machine, removed this piece and tied it off with more dental floss. And then he just kind of pushed the wound together and it stayed. Because by that time, the skin was palatable enough with the embalming chemicals and it would stay where it is. Then he took this item and cut another slit almost under her armpit and then reinserted a smaller tube just like this, only just littler, if that's a word, which I don't think it is, and pointed it in this direction and turned the machine on. Pretty soon this hand started to turn pink, and not kidding, looked pink and colorful just like my hand you see now. You see the pinkness in the palm and then the paler parts in the creases? That's exactly what it looked like. It's very interesting. Now for the horrifying part. While this is all happening, I started to notice that some very light pinkish, I don't know, yellowish fluid started coming out of the mouth and dribbling down the side. And he said, that's excess embalming fluid. Don't you worry about that. I was like, okay. Actually, I'll be honest. I wasn't nauseous by it. It was actually very interesting. And he was very dignified about it. He wiped it off as much as he could and said that happens. And that's when you know it's pretty much done. Then he goes in, and I'm going to use a thinner pen for this so that you guys can actually see what's happening. Or, you know what? Let me just draw another dead face. After all, this person is dead, right? So in the face, person is dead. Instead of doing the dead eyelids, I'm just going to do the eyes. Now, I know I'm drawing the eyes as if they look open, but pretend they are closed. They have these little plastic pieces, I kid you not, that look like, kind of like a contact lens, only it's shaped more eye shape. And then it has little spike divots on it pointing in a certain direction. What he does is he opens the eye, lays this in with the divots pointing down, and then pulls the eyelid up and over it like a sheet, like you're covering something with a sheet. And then you just kind of prod and maneuver the eyes, because when a person dies and they are laying on their back, let's go over here. This is going to be the side profile of a person's face, okay? This is the nose, and the eyes are in here, right? When the person dies and everything settles downward, even the eyeball, which is supposed to be up here, sinks downward into the head. So it's actually down here. These little caps here help push the eyelid up so that it looks like the eyeball is still at this level here. They do that for both eyes if needed. Not all of them need it. So then the next thing to do is to open up the mouth. They will open up the mouth, pull the lips up and out away from the teeth. Yes, it's going to look like that. And because the person's been embalmed, the skin stays right where they pull it. And it's very interesting, like Play-Doh. I don't know how else to explain it. Not that the person has green teeth, but I'm using green so we can differentiate the teeth here, okay? So you're going to see teeth and gums, right? And then he exposes the gums. He takes a little, looks like one of those retail guns that you punch plastic tags through, and he literally staples a piece of wire right into the bone of the jaw, and then he staples another anchor right into the bone above the top teeth, and then he has these two wires sticking out. He ties those two wires together to keep the teeth together, and then he does it again over here. And then he wires it together over there. Then he pulls the lips back down and maneuvers it so it looks normal. And there you have how they keep the jaw from falling open. That's the only way I can think of it. So if this is from the side view, this is a person's tooth, there's the gum line, and then this is the chin, and this is all bone right here. This gun, I didn't mean to make it draw like a fang, by the way. This gun shoots in a piece of metal anchor that's barbed, and then the wire hangs out like this, and that's what he uses to tie it. I hope my drawings make enough sense to you. But boy, that drawing right there looks horrible. So let's just fix that up. Big old spot. Then afterwards, he does take kind of like a antibacterial disinfectant soap and a small, like a shower head, and he cleans off the hair, cleans off the face, all this stuff that was dripping out gets washed away. And then he puts the person with their arms, usually crossed across their chest, and then he lets them sit there, and at least for a couple hours lets everything settle. Mainly so that the hair and everything else can dry, but also because the cosmetics person will have to come in next and do makeup on the face before viewing. Now, if the family is not going to view the body, it's not necessary. In some cases where a body is going to be shipped or buried or have a full body burial somewhere and it's a few days from now, then they will do the embalming. So, interesting how that worked. I know there were a lot more details that he explained to me. A lot of it didn't stick just because it's very scientific and I was not used to it. But these practices here, it almost seemed surgical, the way this person was able to do this. And at the same time, I have to say, a person who has licensed to be an embalmer, I guess anybody could, but this guy that taught me and showed me how he did this process here, did it with a monumental amount of respect for the dead. He had her covered with a sheet, only uncovered what he needed to. Very, very respectful toward her body while he was doing this process. And it's interesting. I would recommend that if anybody had the opportunity to sit in on an embalming, take note and take the opportunity. It was very enlightening. So if you have any questions, let me know. I am not an embalmer by any means, so I couldn't probably answer a lot of the questions you might have, but if it's simple enough, or a question about what it looked like, or something that, is it true, or did you see that, did you see this, let me know. I'll answer your questions. I've already got 2 that's been emailed to me. Can't wait to answer those. But if once I get a 3rd question emailed over to me, I will definitely make another video and answer all your questions to your heart's little desire. Your little heart's desire, right there. All right, guys. Thanks for listening, and hope it was educating. I hope I didn't gross anybody out, but really, this is life, and this is the true thing. It is kind of an invasive procedure to have done if it's your mother. What you don't realize is being done, you think is being respectful. Just bear in mind that it is a process. So if that's what you want to do for mom, by all means. But just understand that there is a science. Anyways, you guys take care of yourself and live your life to the fullest.